Some people are surprised that red blotches on their neck or chest are really the cumulative expression of all the sun they've had from the time they were a kid on.
Today, we're answering your questions about the different types of cancers. The most common form of cancer is skin cancer, but the encouraging news about one of the skin cancers, which is the most deadliest, melanoma, is that it's 100% treatable and preventable. I've invited my colleague, dermatologist Wendy Sadoff, who's also my dermatologist, to the show to give us the facts. Dr. Sadoff, welcome again.
Nice to be here.
Yeah, thanks for coming back again. So, let people know what is melanoma and what can they do to prevent it?
Melanoma is one type of skin cancer, and it is the deadliest form, as you mentioned, and it is really a very preventable type of skin cancer. So it's estimated that in 2018, we're going to have about 180,000 new cases of melanoma. And this is one that, I mean, with the body being, skin on the body being visible and you can see the cancers, it's different than it's an internal organ, so you can have your exam, just look at your skin, and that's the best thing that you can do in terms of noticing any changes in your moles or any new lesions, things that look different. So we really encourage people to look at their skin on a regular basis, maybe monthly, and notice if things are changing or if something is appearing or behaving different from the rest.
And really knowing your baseline. I want to go back to something she said. I mean, that the number of cases that she talked about would fill, we're in Detroit, so we have a place called Ford Field. It would probably fill 3 of those stadiums. That would be the number of people they're getting this. So it's not a small number. Serious problem that I think we can prevent. And the idea is that know what's normal so that you can know what's abnormal. Mm-hmm. and go to an expert like Dr. Sadoff that can help you to understand, first of all, how to examine your skin and get an examination by her. How important is it for folks out there to get an examination by you? I got one. It was painless, and we actually showed it on television. And pretty easy, right? And why should people do that?
People think it's a more involved thing. They think a skin screening, it's going to be very involved. It can last even 5 minutes or sometimes even less. It's a very quick visual exam aided by an instrument, a handheld instrument called a dermatoscope. And it's a way of giving you a baseline. And there's a lot of education that occurs during that exam. I can point out things that you may not have noticed. I can give you suggestions for, watching your skin, or I can point out areas where you may not have realized you've had more sun exposure than you think. Some people are surprised that red blotches on their neck or chest are really the cumulative expression of all the sun they've had from the time they were a kid on. And it's the time I can really talk about avoiding behaviors that result in increased risk of melanoma. So it's really good to watch your skin, but really change the behaviors that lead to these changing moles also.
What are some of the common things that we can do to prevent skin cancer and melanoma?
Be really aware of the amount of sunlight you're getting.
Yeah.
So about 95% of your risk is really due to the sun you're getting.
Absolutely.
Either outside or from the tanning beds. So obviously I'm really opposed to going into the tanning beds. We're seeing an increase in the incidence of melanoma related to that.
Really?
And so just a needless increase of your risk. But wear sunscreen, hats, sunglasses, be aware of the time you're outside, and also realize that you're getting ultraviolet light even when it's cloudy, even when you're driving.
So let's say you do everything you can, you still get a cancer. Is all hope, lost? Is if you get a melanoma, is it treatable?
It's highly treatable. So the best news is if it's a thin melanoma, if it's a very, very early lesion, because then you're talking 99% curable. And with a very minor excision, you'll just have local anesthesia, cut a little normal skin around the lesion, few stitches. It's one of the easiest, quickest treatment to be able to result in a 99% cure rate. It's incredible.
But I want to speak about people that are dark skinned like me. I've got a lot of African American patients say, this is not my concern. Absolutely wrong, right? You can still be African American or dark skinned folks like me and get melanoma, right?
It's actually more deadly, usually in a darker skinned individual. We emphasize a lot light skin, light eyes, but it's really everyone.
Exactly. And soles of your feet, can you imagine that? So all of you folks who are more like me or darker skin cannot ignore this advice, cannot ignore it. Always fabulous and always great information. Thank you for coming on. Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.